first one, she was due at 8:10. She's DNA'd 11 times. The second one...
They're on their 4th DNA now.
Yeah.
We do have patients that are regular do not attends or DNAs. We do try and contact them. Their practice nurse and their GPs also try and recommend that they come, but obviously it's their patient's own decision if they come or not.
Learning a bit more about your eyes and what's going on inside them could be just the incentive you need to make it to those annual appointments. Top line, it's serious stuff, so stay with me.
Okay, do you want to come on through?
Thank you.
Retinopathy is a complication of diabetes, and it affects the back of the eye, the retina, the seeing part of the eye, and it can cause sight loss, and it's very important that we capture it early and treat it and restore sight.
TBHXUA. You know, if you want to keep your eyesight, then you have to come, and it's literally, what, an hour of your life?
Come in, take a seat for me, okay? Hiya.
You can damage your eye if you got high diabetes, so you can damage kidney, anything can happen. It is very important. Health is very important.
I'm bus driving at the moment, so with me it's a very delicate situation because at the end of the day I could have my licence revoked and no job, so it is a bit frightening.
Diabetic retinopathy doesn't necessarily have any visual symptoms until it's quite aggressively moved on quite a bit.
Unmanaged and unrecognised, it will progress and you will lose sight, and ultimately you will go blind.
I had a problem once, going back a couple of years, that my diabetes went haywire, and it really did affect my eyesight. I could see, but it was all blurred.
Have you had any operations or injuries to your eyes?
No.
I call the patient in, I check the patient's details. We do a vision check.
TBHXUA.
I'll put some drops into their eyes then. They do sting a little when they first go in. That's it, close your eye and hold that right in the corner of your nose for me there, please. Okay. That's it.
Didn't sting, it's just you always blink when something goes anywhere near your eye.
And these drops then, they just dilate the pupils, make them nice and big, so it's easier for Janine to take the photos then. So then I show them back into the waiting room. It's 20-minute wait then for the drops to work, and then Janine calls them through then.
There we are, take a seat, make yourself comfortable. Can you see a green or white dot?
Green.
Lovely, just stare at that for me. Really, really wide.
All of the images come back to our central grading suite in Treforest, just outside of Cardiff, and our grading team will assess those for anything wrong with the back of your eye related to your diabetes.
This is the structures. So this is the iris, the coloured part of our eye, and the pupil, which is the opening. The photographer will have taken a picture which would have gone straight through the back of this, and we will end up with the retinal picture, which is the image that we see at the back of our eye. So we'll take some of the colour out of the image, and if you look closely here you can see that there's a little round dot here. There's a little focal microaneurysm, which is a little pocket within the fine network underneath the eye, which is the capillaries, and this is one of the earliest forms of retinopathy that we can observe. Microaneurysms can be caused by high blood sugar levels. There's just the one, thankfully, in this patient's eye that I could see.
If diabetes is not controlled, things can start to get out of hand without you noticing a thing to start with. Here's another example.
Sometimes when those microaneurysms burst, they become what we call a hemorrhage, so it's a bigger bleed at the back of the eye, and these can be quite clearly seen on the retina, and we can see some quite significant changes due to diabetes. The very difficult thing to understand here is that the fact that the patient's vision is completely unaffected. They think their eyesight is normal, but as you can see, the retinal picture looks quite significantly different, and we can see a lot of hemorrhages and a rather worrisome type of hemorrhage which is called a pre-retinal hemorrhage, and if this is allowed to continue to grow, it could bleed and then burst into the vitreous and make the patient essentially pretty much blind in that eye, and they may need some very, very sort of significant surgical intervention to prevent any visual loss.
Don't turn off, that's the last scary picture. But do you know how old that patient was and how much she knew about it?
This patient is 25 years old. and they have no idea that they have this level of retinopathy at the back of their eye.
Don't panic, most people are absolutely fine thanks to the screening system. It spots problems really early, but you've got to go to know.
There we are, just stare at that now and as wide as you can again.
It's very important because you won't realise you've got it. We'll find it, if it's there we'll find it, and we can do something about it. We will look after your eyes, but it's an indication that actually there's something wrong. If you manage to improve the control of your diabetes, you can actually reverse background retinopathy.
Okay,
Yeah, sit back now.
right. It's for your own good, isn't it? Because it's quite a serious thing, really, to have diabetes too, isn't it?
All done. What I'll do now, I'll send these off and you'll have your results sent to you in a few weeks. Just sit back and relax now, okay? You alright?
Yeah, great.
Yeah.
I'm telling you, go and keep your appointment because it's well worth it. To save your eyesight, which is so important, it is.
I'll see you next year. Thank you very much.
To talk about an appointment, please call 01443 844 244.